Hi, I'm Jolie Root, and I am the Senior Nutritionist and Educator for Carlson Labs. Let's talk about vitamin D. The weather is getting colder, and that's the time of year when you have to think about whether or not you're keeping your vitamin D levels where they should be. Let's start with some signs and symptoms of vitamin D deficiency. How would you know? Well, mood changes, that's a sign. Bone or joint pain, bone loss, muscle cramps or muscle weakness, even fatigue can be a sign of a vitamin D deficiency. So the way to determine if you have your vitamin D level where you want it to be is with a vitamin D test kit. Carlson has a really nice at-home test kit that you can do and find out in a matter of a couple of weeks where your vitamin D levels are. Ideal vitamin D levels are 30 to 100 nanograms per milliliter, and mid-range in there is probably the best. If you live in a country where the measure is a nanomole per liter, then the normal range is 75 to 250 nanomoles per liter. And again, you want to be somewhere probably in the middle of that. Now, how do you boost your level if you find out through testing that your level is low? Supplements. And most adults to be mid-range in a normal level probably require somewhere around 4,000, 5,000, maybe even 6,000 international units per day. So if you're taking less than that in your multivitamin, you may want to just bump up the dose. The experts feel that it's perfectly safe to take up to 10,000 international units per day. And doctors will often recommend 50,000 unit doses. Sometimes that's weekly when a person's level is very low. So a supplement always should be vitamin D3. And the range for most adults is 4,000 to as high as 10,000 units a day. Don't let your vitamin D levels slide. It's important to keep them up where they need to be.